This video is a full breakdown of a median nerve entrapment, the most common cause when a client presents with carpal tunnel syndrome. I cover the following: why do nerve entrapments occur, signs and symptoms of nerve entrapments, common locations of median nerve entrapments, and successful treatment process and case management for long-lasting pain relief. For those of you who don't know me, my name is Dr. Matt Maggio, and I am a non-surgical expert in chronic pain treatment. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and reducing inflammation from chronic pain naturally without the use of medications or injections. This results in a significant increase in flexibility, function, and long-lasting pain relief. I'm also the creator of the Peak Method, where we teach overworked massage therapists a new treatment system that cuts session times in half and eliminates the frustration of inconsistent results so they can avoid burnout and help more people get out of pain. All right, so median nerve entrapment, clinical presentations, long-lasting treatment process. Let's get right into the video. Let's just start with the idea of nerve entrapments, why they form, why they're a big deal. So usually what happens is when people are, sitting in bad posture, maybe they're not moving enough, maybe they're moving too much, maybe they're stressed, really stretches out the ligaments in and around the muscles and the joints. They develop this stuff called adhesions, like glue that gets inside the muscle, also known as scar tissue. And then eventually the force has to go somewhere. So then a lot of times it ends up going to the muscle next. So then it gets into the muscle and the fascia. And when it gets inside the muscle and fascia, first thing it does is it makes the area less flexible, and then it does make it weaker. But then over time, as the adhesion gets bigger and bigger, it eventually gets stuck to the muscles and the fascial adhesions around there. And nerve entrapments are built with about 15 nerves are built with about 15% of like extra slack to allow them to move through the body and where they need to go. And when they get stuck to all that adhesion in there, they get entrapped and then they cause bigger problems. So signs and symptoms of a nerve entrapment, there's like three levels that we usually see it. The first stage is they might just get a little bit of like intermittent numbness, some aching, some burning, and a little bit of minor tension, like nothing too crazy, but enough where they're starting to notice it just a little bit. Second stage is where you're going to start to see some postural changes, like maybe their shoulder's going to roll forward, their head's going to duck down, things like that. And you're going to see increased tension and localized tension as well, because what's happening is the body has a hierarchy and it wants to protect the nervous system. So if the nervous system is entrapped, it's going to try to work around it to not load that nerve as much. That's when you're going to see things like postural distortions. You see things like upper cross syndrome or wing scapula. A lot of times those are just effects of an underlying nerve entrapment. So they're not really the cause, they're the effect of what's going on. And third stage is when they're going to be in extreme pain. There's going to be a lot of inflammation. Now you're going to start to see some degeneration of like the tendons in the joint. So like I said, it starts in the ligament, then it goes to the muscles and fascia, then goes to the nerves, and then those postural distortions happen. And then what it does is puts like the cartilage in a bad place, the discs in a bad place, the tendons in a bad place. So the force continues, has to go somewhere, and then it goes from there. That's when people really start to notice things. Maybe they start to do something about it. A lot of people don't do a lot in stage one. Some people are proactive about the problem and they'll do it, they'll come see you in stage two, but most people wait till it's really bad. And then there's a lot of stuff going on. So that's the underlying idea of like what nerve entrapments are and why they occur. So what I like to do when I'm looking at a nerve entrapment is kind of check the whole course here. So for the median nerve, the first place you're going to actually find it is in the transverse carpal ligament. That's right where the carpal tunnel goes through, right between the web in here in the hand as well. And a lot of times what'll happen is that's where most of the symptoms will occur. That's where the client might have the numbness and tingling into the fingers, into the hand. It's crazy sometimes, though. Anytime someone has any type of numbness or tingling down the arm, past the elbow into the hand, they automatically default to, oh, I got carpal tunnel syndrome. There's so many other nerves that can get caught. But this is where they like to do the carpal tunnel release. They'll go in there, kind of basically just snip away this ligament, which in turn buys you a little bit of time, frees that nerve up a little bit. But like I said, down here is actually more of the effect, not the true cause. So the first area where you can see it, where symptomatic wise, you're going to see it a lot further down the hand because it's been going on for a while. Then the median nerve has a long way to go. Basically, it actually starts higher up in the nerve roots in the neck as well. And it has distributions all the way from like C6 all the way down to T1. And then what it does is it comes under the shoulder blade here on the front part of the subscapularis and what's called the brachial cords. That's where some of the entrapment can occur as well. And then right underneath the armpit there where it comes out, there's what's called the neurovascular sleeve, another area where it can get caught. And then a really common area where you see a lot of nerve entrapments of the median nerve is going to be basically between the tricep and the bicep. Right on the brachialis on the medial side there, it gets caught up there. Then it takes a path where it goes here. And a really common area where it can get caught is called the pronator teres in there. And it gets caught right in through there. And it kind of sits right on top of that muscle, very common area. And then one that a lot of people miss a lot is a very deeper muscle. It's called the flexor digitorum superficialis. It's actually cut away in this photo here, but that's a really common area where the nerve entrapment occurs as well. Then it makes its way down and gets caught down here in the carpal tunnel. So like I said, a lot of the patients and clients come in and they got a lot of tingling, numbness through the hands. They go get carpal tunnel release. Buys a little bit of time, but it's kind of caught the whole way up there. It's caught in different places. There's no rule that says it can't be caught in just one place and get caught in multiple places. And a lot of times when you're seeing a client presenting with carpal tunnel syndrome symptoms, a lot of times you want to ask a question, was there like a direct injury there or not? And a lot of times there wasn't a direct injury. So I'm thinking it's somewhere further up the chain, but you got to check the whole chain to know really where it's getting caught and where it's getting kinked up. So what is successful treatment process and case management for long-lasting pain relief? What I like to do when I'm treating nerve entrapments is I actually like to start distally further down and then work my way up. So in this one, what I would do is I'd be in the transverse carpal ligament first. Then I'd go to flexor digitorum superficialis, then pronator teres, then up through the arm, then the neurovascular sleeve, then into the brachial cords, then into the nerve roots. I'm going to start distally and kind of work my way up to the neck. When you're doing the treatments here, the treatment mechanics are really important as well. A lot of times when people are treating nerve entrapments, a lot of times they get too compressive with it. So nerves are kind of like the Goldilocks of things in the body that can get inflamed and cause issues. And if you're too compressive on them, they get mad. If you don't get enough depth on them, enough tension, they don't break down. So you got to get it just right. And what I find is more people are too compressive. You need to let that nerve be able to slide as you're breaking that down. So basically what I do is I find where that adhesion is. I get my hands in there and I go just below it. I don't go right into it. And then what I do is I back out about 10% because you don't want to be too compressive as you're going in there. And then I want to take tension right into the area as well. And then I have the client go through a full range of motion as I'm basically holding that adhesion back and forcing that nerve to break free as it does it. You always want to be slow and precise. You know, a lot of people just go in there and just kind of go crazy on an area, just beat the hell out of all the tissue, and then they really don't know what's working. You want to be slow, precise, and very focused as you're going in there. You got to really allow for that tissue to properly slide. You know, a lot of times what happens, like I said, is people are way too compressive and they get feedback from the client. The client's like, oh yeah, that hurts. You must be doing something. Just because it hurts doesn't mean it's actually doing anything effectively. It actually could be making the problem a lot worse. And temporarily it might feel better, but it's not actually fixing anything. You're not actually making a change in the tissue, in the muscles, in and around the nerve entrapment. Next thing is it's not a trigger point. I hear people all the time, oh, I got trigger points everywhere. They are not a trigger point. A trigger point is a totally different thing. A trigger point is actually a normal muscle response because usually around that area is where the nerve entrapment is. So the trigger point kind of forms around there to protect the area. So if you keep just treating the trigger points but not addressing the nerve entrapment, it's going to continue to come back. That's why people get their trigger points treated, but then they come right back. Trigger point is the effect, not the true cause. And on these ones, you want to do no more than 3 to 5 passes. When you find an area, treat it, be done with it. It's not a very long treatment. It's very precise, very focused, very intense. And when I was talking about here, number one, starting distally and working my way up to the neck, I don't do all of that in one visit. Basically what I'll do is I'll spend like maybe 2 or 3 visits, like just in the hand up through the forearm as well. Then I'll work my way up to the arm, the brachial cords, neuro sleeves, and then up in the neck as well. I'm not treating everything in one visit. It's too much dosage. And then I'm not really able to see where the majority of the restrictions are. I'm not getting a lot of data. I'm just doing a bunch of treatment kind of, haphazardly and not getting to the effective area where the problem is. And when you're doing these treatments and you're treating these nerve entrapments, it's not about the amount of treatment you do. It's like getting the dosage correctly. I'll do one pass and then I'll let the client kind of chill out, move their hand around a little bit, because it is very intense when you're treating these underlying nerve entrapments. And if you just go really hard, really fast, don't give it a chance to heal. You're actually going to get too much inflammation. You're going to get too big of a response, and the nerve is just going to get angry and cause more tension. So be precise, be slow, feel, let the tissue slide. It's going to make a big difference. You don't have to beat the hell out of the tissue. You can actually be very precise and very focused and get some amazing results that last. That's all I got in the video. Appreciate you watching. Any insights you might have got, drop them in the comments section below. I try my best to engage and talk with anyone that, has questions or wants to learn more. You can also do me a solid and share this with other providers that it might help. I just want to get this care out to more people and have people, help more people get out of chronic pain. And lastly, if you like what I'm talking about, you like what I'm teaching, you like what I'm training, you can go download our free training modules and you'll get full access to our full online course. And they actually come with free credits in massage therapy if you need them, up to 16. We did that so you could just go through the course and understand that. You'll get the whole body. You'll get neck, shoulder, mid back, low back, and hip. Really get an idea of the system, what it is, what sets it apart, and really get on the path of like being a true problem solver instead of just providing random treatment, and get that reputation in your area as someone that can actually fix problems. Links to download that or wherever you're consuming this. I appreciate you watching the video, and I'll catch you on the next one. Bye.